very excited to be talking to you today about Titan Dental Design, which is a program we developed to commercialize 2 patents that took over 10 years of research to develop. And the first patent is related to 3D facial diagnostics to modernize orthodontic records and integrate them with the delivery of care. And the second patent is designed to allow orthodontists to combine clear aligner therapy with fixed appliances on the same platform to get the best of both worlds. Titan gives you the ability to capture records, diagnose, plan treatment, design and manufacture appliances all on the same platform. We're all familiar with the principles of ALARA. We know we're not supposed to take a routine set of radiographs for every patient. We know we can affect things outside of that box, but we still expose a lot more than that area because our orthodontic analyses that we were taught still use the cranial base as a reference, just like we did 100 years ago. So one of our goals was to develop an alternative to the cranial base to allow us to customize our field of view. In some countries, you're no longer even allowed to take a post-treatment step, so we do need an alternative for medical legal reasons, and for record keeping and outcome assessment. So the eyes were our target. We used the Maurice growth study sample to show that the eyes are at least as stable as a lot of the cranial base references that we use for our analyses. We showed that you can do a superimposition using the eyes and a natural head position that gives you a lot of the same outcomes that you get from a traditional cranial-based superimposition. We published several papers showing that a traditional ceph analysis correlates very well with measurements that use the eyes as a reference instead of the cranial base, whether it's on a ceph or whether it's on a 3D dentofacial image, and it even correlates better if you combine the facial image with a limited field CBCT. What that allows you to do is it allows you to limit your field of view now that you're not using the cranial base as a reference. The eyes are the reference. You can integrate that 3D facial image with the CBCT, with the intraoral scan, and just expose the area of interest, whatever it is for that particular patient. It also allows you to shield the areas that you're not exposing. So you can use a lead cap, a thyroid collar. So if you take a limited field, low resolution CBCT, with the proper shielding, you can reduce the equivalent dose for the thyroid, for the brain, for the eyes, the pituitary, and even the overall effective dose can be less than what it would be for a traditional pan and ceph. We developed norms. We started out with adult aesthetic norms for males and females, since our work showed that the shapes are different enough that they should be separate populations. We developed a modern Maurice mesh analysis, which is a visual analysis that shows arrows from where the landmarks are to where they're supposed to be. Without looking at a lot of tables and numbers, you can easily see here the lower face height's long, the upper side of the display is greater than it should be. And AJODO, we published a paper that showed that orthodontists reach the same treatment conclusion whether they use traditional records or our proposed records. And we also developed age and race specific reference values, and we integrated them into the software. And we also designed it so that you can design aligners and move the teeth within that context, knowing where you want the teeth to go and to be closer to what is more aesthetically pleasing. And that takes us to the next patent, which is integrated clear aligner therapy with fixed appliances. We often have to make that decision of whether we're going to treat this patient with braces or clear aligners, and it doesn't have to be that way, especially if you can, we know aligners have limitations, and wires are often able to, those limitations are the strength of wires and fixed appliance treatment. The patent is basically it allows orthodontists to integrate the two and get the best of both worlds. It's basically an attachment with a hole in it that allows a NiTi wire to move the teeth to the same place that the aligners are going. And Titan allows you to have aligners that take into account those tunnel attachments and includes them in the aligner design. Here you can see a case where premolars were extracted on a clear aligner case, and you see the typical molar tipping. And you may or may not be able to upright that molar with many, many refinements, but with tunnel attachments within a few months, you can see that molar is already uprighted. We did a randomized clinical trial that showed that refinements with tunnel attachments pick up non-tracking teeth a lot better than traditional refinements without tunnel attachments. So I'll give you a little demo. In the old days, we'd have to use a 3D MD type camera to capture a 3D facial image, but now you can do it on your iPad, kind of like what I'm doing here, within seconds. And then you can do the same thing for the smiling picture. You can also facilitate the connecting the face to the teeth. The landmarking is automatic. You can obviously adjust it and fine tune it. You can align the face to the teeth, and the automatic alignment usually works pretty well. And you can modify it a little bit as necessary. It shows you arrows from where the landmarks are to where they should be. You can see how I'm a little bit retrognathic there. And you can go from there to actual treatment. And so, for example, you can move that tooth out, and so on. There's an automatic movement, and you can do IPR and all the usual things you can do. And down here, it shows you how many aligners you've got. And you can send them to your local lab or to an outside lab or your in-office lab. We've got attachments. The attachments optimize to the direction of the force. You can customize their shape and size and so on. We have a big library of attachments. You have ramps. You have a twin block feature, but you also have tunnel attachments. So let's say you know that canine, you've already done a few refinements and you struggled with that canine. So you can design it, you can kind of limit what area you want the tunnel attachments to be in. You could have it just to those teeth there. You could have them buccal or lingual, and it makes you a template, and your aligners kind of include the shape of those attachments so that there's clearance for the wires. Then you kind of label them and send them to your in-house lab or whatnot. So in summary, Titan's basically a tool to empower orthodontists, make them less dependent on corporations, and gives them the ability to capture records, design, diagnose, plan treatment, design fixed and removable appliances, all on the same platform to provide better care for our patients at a lower cost.